Welcome, everybody.
Yes, that's one of those.
So Mindy's in Arizona, so I'm doing the MC duties, I guess, here. We thank very much Shriners Hospital for hosting it today. And our agenda will include the usual sharing of ideas, questions, cases, and then we'll follow that with a presentation about Shriners car seat program, and then there will be opportunity for a tour of the hospital. And thank you also for the food.
Yeah,
wonderful.
Welcome.
So why don't we start off with introductions? I'm Chuck Moore. I'm the director of the Medical Portal. With his mouth full, I'm
Greg Hawks. I work at James Mason Centers for Recovery. We work with teens who are dealing with mental health issues.
My name is Gabi Baragushi, and I'm a quality improvement coach at UPIC, and also helping Mindy with the medical home portal a little bit.
And I should mention that Mindy is here virtually. She's on GoToMeeting.
Mindy, you want to quickly introduce yourself?
Hello, I'm here from Phoenix. And hey, while I have the mic for a second, I'll just remind everyone that James Mason Centers for Recovery is having a celebration tomorrow. So hopefully everyone saw that email that I sent out that Greg provided. That's tomorrow.
Yeah, tomorrow, 3:30 to 5:30. Thanks, Mindy.
What do you celebrate?
It's our 3-year anniversary.
Okay. Yeah.
Good. Nice.
I'm Christina, care coordinator for University Pediatrics.
I'm Natalie Allen, and I'm a nurse practitioner with our name is new. We're called the Clinics of Utah. Integrated Services for Children with Special Health Care Needs. Anyway, we're going to be doing, starting up the child development clinics again and doing some traveling clinics again, getting that started and back in place.
Do you have a brick and mortar?
Do we have?
Where are you guys located?
Well, we are located in the Highland building in the department.
With the integrated service.
Okay. Yeah. So that's where we live right now. Yeah.
And I'm Carrie Martins from Integrated.
See, she's just going to say that.
Well, I haven't learned the new.
Walton works with Integrated Services Program also.
I'm Heather Adams, I'm a parent consultant for the MEP, Early Detection and Intervention Program.
I'm Tammy Brandis from Northern Utah Pediatrics at KB, care manager. I'm Amy Cherry, and I'm the care guide for CMD at Northern Utah Pediatrics.
I'm Kay Haynes with the resources for the medical home portal.
Heather Carlson, I'm part of the Integrated Services Program.
Chelsea Amadou. I am the care coordinator at the outreach down on public health down in Blanding.
Wow. Did you get the prize for having traveled the
Yeah.
All right. And I'm Julia's product with the Integrated Services Program in Oregon. This is Lisa Lynn, care manager at Memorial Clinic.
I'm Gail Roker, care manager.
I'm Lucy Sam, I'm the care manager.
I'm the care manager at Southridge Pediatrics.
I'm Carly Falls. I am the care guide at Southridge Pediatrics. I'm Neva Stevenson. I'm the physician liaison right here at Shriners.
And I'm Jill Connor, Director of Business Development here at Shriners. So welcome to Shriners, everybody.
Yay.
And just a quick show of hands, how many of you have been here before? Okay, so, and how many would be interested in touring the facility? Show of hands.
Great.
Awesome. Heidi?
Hi, Kate. I'm the pediatric manager for the University of Utah Community Clinic, mainly Redwood, but I help out with all the others.
The two of you
I'm Leanna Reed, and I'm the manager at the Southwest Children's Clinic in West Jordan. I'm Kim Perry, and I'm the care coordinator at Southwest Children's Clinic.
Great.
There's still a chair right here, somebody wants to sit here.
Okay, great. Well, thank you all for coming. So open it up for cases, questions, ideas, seeking resources, successes you've had. Follow up from previous cases. Nobody's facing any challenge.
Or so many, they don't know where to start.
This is Mindy, and I'll just mention that we have some new content on the medical home portal. I don't know if Chuck might want to show it, but we have a brand new diagnosis module on transgender and gender diverse, which we're very excited about. So I hope everyone saw the announcement about that. But I thought I'd mention that because that's been a kind of a big deal for us recently.
It wasn't so small, I could not do this.
Oh my goodness, this is good.
Yeah, I could have fixed
Small
that. Smaller. Okay, no, I'm not showing that.
You can always just toss it over to me if you want.
Well, are you seeing my browser now?
No.
We can see, no, we only see the PowerPoint presentation right now.
Okay, I'll throw it over to you, Mindy.
Okay. Okay, great. All right, hopefully you're seeing my screen. It's got the June 2018 portal periodical up there.
Yeah,
We're getting there. We're getting there.
You see it now, Mindy.
We can see it now?
Yeah.
Okay, great. Okay, so this is the part of the newsletter that we send out quarterly that talks about anything that we've put out there new or updated. And so here's the link to the transgender and gender diverse, and this is a full diagnosis module. And I would just be curious to know, if any of you have had patients that you've seen in your clinics or in other settings that might benefit from some of the information in this module. And of course, I can't see if anyone's
What we
nodding
see in
or.
our clinic is, what I found really helpful here is that.
Speak up just a little bit.
Somebody needs to speak up, yeah.
What I found super helpful and actually printed out and gave to our physicians is, a lot of kids want to know what they need to do to do the testosterone or the estrogen, and you have those guidelines on here, which is helpful for the physicians to be able to see. And you have a sample letter for the gender affirming bathroom, which is helpful.
Yeah.
You don't have to make that up, it's already in there.
Good.
Yeah, it's interesting. The two pediatricians.
Anybody else have experience with transgender?
You're breaking up, Mindy. Can you speak up?
Oh, okay. I'm sorry. Yeah, I was just going to say that the two pediatricians who wrote the module were fairly emphatic about the letter being added. Not that we wouldn't have done it, but that's a big deal, a big deal. And I'll be honest, I'm not 100% sure right where it is in the module. Chuck might know that a little bit faster than me, but I've read the letter. It's very simple.
I think it's down in the resources.
Okay. But yeah, it's very straightforward. But you could see
I think
how.
it's down in the resources. I think under.
Let's see. Here we go. It's going to take just a moment. Anyway, that's great.
Yeah, there it is. Under other.
Yeah. Glad to hear that it's helpful.
Any other comments or questions about that or anything else for Mindy?
I'll just say the other thing that I was going to point out is that we just published some information on syncope. And here, I'll turn that. Oh, sorry. That's my son.
Syncope.
No way. Yeah, let's go back to that. Here we go. So does everyone know what syncope is? Because I didn't. Syncope is
fainting.
Yeah. I don't know, Chuck, if you'd like to mention that this is something that most of the time can be handled in the primary care office. I'm not sure if you can hear me. Are you able to hear me?
One of the reasons we got this module going was their sincere effort to not have them see specialists, because specialists have a tendency to overdo things when they're not warranted.
Yeah. Mindy, your audio is not very clear.
Yeah, I'm sorry about that.
Are you able to hear us okay?
Yes.
Yes, she says yes.
Okay, do you want to pass it back to me?
Yes. I will. Let's see. Oops. Just a second. Okay. Great.
Okay. So we've got a case.
Well, I can report on a success.
Yeah, we'd always like to hear that.
Last year or year before, we talked about different models for mental health. And Intermountain has a model called medical mental health integration. And I kind of giggled about it when I was part of the panel, because at that point, we had a psychiatrist leave and a psychologist leave. So it was kind of down to bare pickings, one psychologist left. Well, now we have a full staff. We have a psychiatrist, and we have a clinical social worker, and we have a psychologist. And luckily, we had a parent call. It was a 14-year-old. She was threatening suicide, had a plan. Mom didn't want to take her to the emergency room. Not sure why, but she did not want to take her to the emergency room. She called it 8 by 10. She called a psychiatrist. They worked out a whole Columbia suicide risk, did a safety plan, determined she was okay to discharge, and now she's following up with one of our licensed clinical social workers. So it was a real success where everything fell into place and worked right. So I will say it is very, very, very advantageous to have people on site who do mental health. And because of the delays everywhere else, it worked well. and not the expense of the emergency room. And luckily, she didn't have to go inpatient at that point.
How do you manage to get psychiatrists and psychologists? That's a challenge.
Well, and it's Dr. Travis Nicholson.
Oh, okay.
And so the partnering with primary care is seen as a very valuable asset, and it truly is. It's been great. So I've learned an awful lot as a care manager, not being a social worker, being a nurse, about how to deal with all kinds of mental health. Yeah. So that was a success.
And what clinic are you from?
Memorial Pediatric Clinic.
Okay.
All the pediatric clinics within Mountain House, psychiatrists and counselors now within our office. So if you have patients that are looking for primary care, I would recommend the Mountain Clinic for that. I think all of them,
Really?
That's awesome.
Yeah.
I know they all have counselors, and I think 75% of them have a psychiatrist. And they're all going to have a psychiatrist.
And they have open space for emergency care.
It's like you can get access to them.
Yeah, it happens.
And they have,
sometimes you're lucky,
Yeah.
and sometimes.
And they
you're
leave grounding time, so if it happens within the clinic, then you're during so we have our psychiatrist who's available the last hour of the day, but when we do our consult, so if she was to come in, she notified our primary care providers that she was suicidal, they would go grab Kyle.
They work off of what's called the 70-30 model, so 70% of their time is spent being patient, 30% is in consultation.
How much time does the psychiatrist spend in each clinic?
Depends on which clinic you're at. We only have them half a day once a week.
I'm for a full day, so I have 7 patients a day.
The downside of it, and I'll put this out here, is that the medical panel is different than the mental health panel. And so that excludes people with Medicaid, United Insurance, I could go on down with it. So that's the only glitch that we really run into.
When you say panel, you mean who you can get paid by.
Right.
We have a lot of patients that are being out of pocket. We do, because Intermountain has the financial assistance program, which does cover behavioral health for children.
One of the goals of mental health integration with primary care overall is really to help the primary care clinicians get better, more adept, more comfortable with managing mental health problems. And one can imagine, well, if you've got a consultant right there, a day a week, you can learn a lot from that person, so that you wouldn't have to meet other for the cases. And it's the huge boon that Intermountain has the benefit of being able to gain from that by, making, care available and reducing costs. It's harder to do in a private practice setting, where you don't have that benefit of the huge organization. But some practices have done it. So it's a model that I wish I had had.
And we certainly have seen that, so we've had psychiatry there, with, Dr. Nicholson and Dr. Giles at Behavioral Health, which has them in our clinic for a long time, and they really done a good job of educating our providers. So every month we have just an informal meeting where they do difficult cases or they talk about certain things. So our physicians are way more comfortable. They don't ship them off to psychiatry after they've failed 2 SSRIs. They know what the next step is, and we've seen that even with our nursing staff. So we've used our psychiatry team, our social work team, to teach safety planning to the nurses. How do you assess for suicidal risk on the telephone so that we don't have to send all these kids to the ER? So it's really been a huge benefit.
The university community clinics have the same model. They have integrated mental health.
They do, yeah. I think Redwood is not quite there yet. Then I think South Jordan has,
Sugar House.
yeah.
Yeah.
So they have the same type of model.
But then Wasatch South, when it really started that several years ago, with somebody who's a psychologist and a physician assistant, I gather they're trying to spread that around to other practices too. Where they've got anybody there.
We're at the Willow Creek office, and we have some psych residents and 2 social workers.
Oh, wow. Psych residents from the youth.
Yeah, and they just started.
Oh, wow. Cool. And actually, why don't you introduce yourself so that you came in
I'm
after the
from Willow
introduction?
Creek.
That's right.
From Willow Creek.
Yeah. Introduce yourself.
Oh,
You're our presenter. Any other cases, questions, challenges you're facing? Something you'd like to get feedback or ideas about?
I know one of our, she's not here, I was hoping she'd be here today, but our care manager out at South Jordan, she has, I think she's older, I think, I don't know, 12, 13, 14, but they have PHP, and they're trying to get an autism diagnosis. PHP will not pay for that autism diagnosis, or the testing anyway, because she's older. Is there anybody, and they, of course, they make too much for any type of financial, with the grants and everything. Is there anything, we all know it's like, what, $34,000 is that? Is there any?
Have they accessed the school system? Have they gone through any testing or assessment?
They're coming into, they're butting heads with the school system right now, from what I understand. They're not in the Jordan district, which I wish they were, but they don't live in the Jordan. She goes to a charter school, but lives in the Jordan district. So they're saying that the charter school has to be the one to give it, not like the
And
Jordan.
they probably don't have the staff.
Yeah.
Yeah, well, I would think that would be her next step.
Right.
That if they're not willing to pay the $3,000.
Right. I just thought maybe.
There are a couple lower cost options. BYU has a low cost sliding scale option, and so does the U, of course.
It's still quite a bit of money for them to do it.
BYU owns the U.
Yeah.
Yeah, it's not bad.
Oh, they quoted her $2,200.
I'd call them double check.
BYU, yeah.
The last time I checked with BYU, they actually didn't have any more open slots.
Yeah.
And then when they were gonna reopen it up, it was gonna be for a younger age grouping and then expand from there. So they kind of fluctuate year to year, but I don't know if the next school year will produce something else.
Are they looking for full neuropsych, or are they just trying to do the ADOS for ADOS?
No, they're looking for full neuropsych. Yeah.
Which is trying to do the ADOS, you can go to someplace like Affinity and Cozy.
Yeah, and that's a way too. So they're just trying to get it in before the school system so they can get an IEP in place, things like that, but it's just not working out for them, so. And they just moved here too, so they're not.
I would too.
I would
keep trying the school district.
Yeah, that's
They can
what
have a meeting.
yeah. We're supposed to have one at the beginning of the school year to see where it is. We also have a 17-year-old. It's kind of doing the same thing, but they're 17, and so this is their last year coming in, and these poor kids that have moved here from you. I mean, it's like California, they have like all these resources, they say, and then they move to Utah, and there's like nothing. Yeah, which is sad. So.
Resource shock.
Yes, yes.
In addition to the culture.
Yeah, especially our refugee families that come in from California, they're like, yeah.
Other cases, questions, ideas? Okay, well, since our presenter is here,
Yeah, and I'll introduce her. So I think many of you, or several of you may know Scotty Jerome. Unfortunately, he had a vacation opportunity to arrive. About that. But luckily, we have Claire Bakey, who is a physical therapist and very involved with the car seat clinic. So she is going to be presenting on his behalf. So welcome, Claire. Thank you. Hello.
I can just advance the slides for you.
Oh, sure, okay, that works, where would you like?
Maybe right over there.
Okay. In the middle of the table. All right, well, obviously I'm not Dr. Rome. But I, like Jill said, have been involved in the car seat program. I'm involved in the physical therapy outpatient department, and then also in the wheelchair seating department. So I've kind of experienced in a lot of different areas. And, yeah. So seating and mobility, it was established in 1998. now by Ken Cazole, which I'm sure a number of you know his name. So things have progressed a little bit since then, as you'll see. So 1998, he did 16 wheelchairs that were donated to the community. And he kind of went out and had to like wheelchair shop from people who were throwing wheelchairs away, and he kind of filled them all together and made things work. Now it's progressed just a little bit. So in 2017, we donated 238 wheelchairs. We see about 1,800 patient visits a year, and did 143 new wheelchair evaluations working with the local vendors in our community. So we still have Ken on staff, which is fabulous. He kind of keeps us on track. We have 3 clinicians. So we have Ken, who's an occupational therapist. We have Scotty and Matt, who are both physical therapists. And then I am PRN and kind of fill in them when they go on vacation, which is great for me. And then we also have 2 wheelchair technicians. One of them is an ATP, which is fantastic. And then 2 administrative staff who get to let everything run our lives, which is great. We do a bunch of different things. Obviously, we do wheelchair evaluations. We do early mobility assessments and specialized seating mobility. So each wheelchair is set specifically for each child. A lot of times families are like, oh, I'm done with this wheelchair. Can I give it to this family? It's like, well, you can, but we have to redo everything to customize exactly for that child, which is a great thing. And we work with the local vendors in our community, and they've been absolutely fabulous. They always come up to our appointments with us, and they do all the fittings with us, and we work really closely with them, which is great. We also do pressure mapping, which has been really nice for a lot of kids that have the spinal surgery. So everything changes after you have a spinal fusion, and so they come and see us, and we pressure map them and see if we need to change their seating or if we need to get them a different cushion, and just assess their risk. We also have a seating simulator, so kids that have come in and never had a wheelchair before, we can kind of sit them in our simulator and come up with a plan for what exactly we need. And then obviously we follow up with the wheelchair fitting. So a lot of times other places will have the vendor just take the wheelchair to the house and then it's done. But we have them come back to us and fit it specifically for them. And if anything's not working, we also like to do follow-ups with all of our kids. We encourage them to come in after like 6 to 9 months. They're one of those families that takes really, really good care of things and everything's always clean. We'll do a year. But we always say it's kind of like your car. You want to bring it in for oil changes and general maintenance in order to keep it running longer. So we encourage our families to come in and keep things running. And obviously kids are growing, so we have to grow up for them as well. Post-surgical assessments, like I said, a lot of times after spine surgeries, but any other surgery where things have changed. Quote from Ken, children with great surgical alignment outcomes should not be placed in the preoperative seating described. It's just everything has changed. Their seating has changed. So this is kind of a few pictures of our team. So this is our Christmas photo. It's very nice. And then these are pictures of our workspace. So over here, this is where our technicians work on their bench, and the center goes up. So it's like an auto mechanic shop back there. You can get in underneath all the power wheelchairs and everything like that. This is our seating simulator right here. And then just all our other different benches where all the tools live and work in the wheelchairs. So we also have started a special needs car seat clinic. It's been going for almost 2 years now. And that is run by me and Scotty. And then we have pretty much all of our technicians and all of our staff are certified as car seat experts, which is awesome. And then we have a medical assistant that works with us as well as one of our pediatricians. And she's about to go take one of the car seat certification classes. She will also be certified, which is very exciting because most doctors don't do that. So that's Dr. Debbie Singer. And we do that 2 Fridays a month, just in the mornings. We usually see 5 or 6 kids, depending on what happens. We assess their current car seat, look at the vehicle, see if their car seat is compatible with the vehicle and what we need to do from there. And we always send the child out safe. So if they come in a car seat that is totally inappropriate, if they've outgrown it, if it's expired, we send them with something brand new at that time. So they leave us in a safe place. So this is an example of one of the special needs car seats. There are many, many of them out there. And we have a number of them here to trial with each child. We sit them in and see what needs to be done and then kind of make a plan from there. Then we have our unlimited camps. So these are camps for children with some form of amputation, whether it's congenital or later in life. So there's a winter ski camp and a summer rafting camp. And those 2 are for children aged 12 through 17. And then the Big Little Camp is for kids 6 to 11, and they're kind of mentored by the kids that are based out of the other camp, so 18 to 21. They just come together and hang out with other kids that have similar diagnoses and similar situations in life. So I was lucky enough to go to the winter ski camp in January this year. It was a fabulous experience. A lot of fun to see them. They feel a lot more comfortable with themselves. A lot of them come in with kind of body issues and concerns about, self-confidence and things like that. And then they're around all these other kids that have similar concerns. How long is the camp? So the ski camp and the summer rafting camp are both 1 week long. And the summer one just barely wrapped up like 2 weeks ago. They go down to Vernal and raft on the creek for. So, and then the Big Little Camp is just like a weekend 2 or 3 day type thing.
What's the age range?
So for the first two, it's 12 through 17. If they're turning 18, there's kind of some flexibility on the two edges of that, depending on where their birthday is in the year. But then the Big and Little Camp is still for 6 to 11, and then 18 to 21.
Is that Big and Little a full week as well?
No, it's just a weekend.
A weekend.
Yeah. So, and they do have to be part of the Shriners program to participate in these camps. But they don't have to live in Utah. They can come from anywhere to do that. So.
And where do you do this?
The ski camp we do up at Park City and through Wabash Adaptive. So it's been.
How many kids did you have at this last one?
Last year, I want to say we had kind of fluctuated at the end there. I think it was about 25. So same with the summer rafting camp.
Is that just for Utahns or the entire region?
The entire region, but they do have to be a Shriner. Other questions?
You have to be a Shriners patient to use their car seat.
No, so it's kind of been, no. So you have to have a referral from the doctor, I believe. We've kind of gone back and forth on that. Do you know exactly what we've decided?
So, the short answer is no.
Okay.
And just call, there's a specific phone number, and in your packets here and on the table, we do have some pass-along cards that have that referral number on there to the car seat clinic. But that's pretty much one of our only services that is available for patients outside of the system.
And because we have the doctor in the clinic.
Yeah, so that's that's how we bypass that. Well,
So are you on a wait list at all for like both the wheelchair and like car seat, or is it pretty much if somebody is inquiring, they're able to get in pretty quickly to?
The car seat program, I think you can get in pretty quickly. I think they might be booked out like a month at the most. I know our wheelchair program, they're booked through September right now, but still not. It's not too bad. And we do have cancellations for people. Summer's always a little more busy. People are trying to get in while they're not in school.
And do you need formal referrals to the wheelchair program and the car seat clinic? Okay.
not the car seat clinic, but all of the ancillary services provided here at Shriners. So, wheelchair and seating, physical therapy, motion analysis, radiology. You do have to be an established patient. So you do need to run through our outpatient clinic first prior to going into those other ancillary clinics, with the exception of the car seat clinic. So, yes, keep that in mind. And the other prerequisite is that the child is under the age of 18. Once they're in our care on their 18th birthday, we will consider to continue to treat them through age 21 as long as it's medically feasible to do so. Any other questions?
Just you and I were talking earlier about how Shriners now bill insurance. How does that play out for patients whose insurance doesn't want to pay you?
Okay, good question, good question. So to give you a little bit of a history, so we are funded by the National Shriners Fraternal Organization, international organization, through a national endowment fund. Today that fund's worth about $8 billion. However, as healthcare costs continue to rise, the draw on that endowment continues to increase. About 8 years ago, we did not have systems in place to bill or collect for patients covered by insurance. And when the economy took a dive in 2008, they decided to finally put those systems in place. So now, from a healthcare perspective, we accept both ends of the spectrum. So uninsured patients, undocumented patients, self-insured patients, even if you have the best insurance coverage. So when a patient comes to us, if they're not covered by insurance, we'll help them walk through and navigate that system of applying for different coverage. If they are covered by insurance, we will bill and collect for the services provided. And if there are any outstanding fees that their insurance provider doesn't cover, so if they have high deductibles, if they have out-of-network expenses, co-insurance, if it is a financial hardship, we will work with the families. So it's really, we don't even like, when Eva and I are in the field, we don't really like to even like list, all right, this is our insurance coverage. Yes, we are on almost every major plan with the exception of Select Health. However, I will say our largest patient demographic population, if you look at our insurance coverage, are Select Health patients. And we're kind of making strides in working with them to get more reimbursement, especially in those areas where Select Health or Primary Children's doesn't provide coverage. So, for example, we cover a lot of pre-surgical treatment for our Halo traction kids. EDS casting is a treatment for infantile scoliosis. So things like that, we're slowly kind of chipping away. But again, we don't want to discourage patients based on their insurance coverage. And it's truly a very unique system in that Shriners does, provide care for those families in need. And there isn't a hard line that we draw. Typically, we say, it's over if they're 400% over poverty level, which is quite generous. However, it's truly case by case. I had a care coordinator actually from a local pediatric office call me one day and say, her son, age 14, was born premature and had medical issues his entire life. And so behind the scenes, they had a lot of medical debt. But on paper, they were dual income family, well-to-do. And she said, can you tell me a little bit about Shriners payment plans? And I said, we don't have payment plans. So that's very indicative of the coverage that we provide. And really all she had to do was just relay that financial hardship to our advisors, our financial advisors at the time of their service. And that's all that was needed. So it's really beautiful in that regard, the fact that it is truly, treating the child first. Based on, what their needs are.
So I think that Shriners in other states are doing the same thing as you're doing, billing.
Yeah,
sure,
yeah. That was a system-wide approach. So we're part of a larger 22 hospital system in North America. We have 20 in the U.S., 1 in Canada, and 1 in Mexico. And the primary focus is ped ortho. However, some of our, we have 4 hospitals who provide pediatric burn care, and a few who have spinal cord rehabilitation programs. Also a few that have cleft lip and palate.
So they also run the same problems or barriers that you run into in working with the insurance company, for example, Select Health?
Yeah, I don't think that's unique. I think in a lot of the major markets, there are those bigger plans that may have, their own orthopedic offerings. So, but again, we have a great relationship with Primary Children's and with Select Health. In fact, Mark Harrison, when he came on board as CEO, he has an extensive background in pediatrics, and he came and toured the facility, met with our administrative team, and so, a lot of collaboration goes on between us and them. And for those of you who aren't really familiar with our medical staff, because we get that question a lot, are you guys related to primaries or not? The short answer is no. We're totally separate organizations. They have their own ped ortho. All we do is ped ortho, but the common factor is with our medical staff. So we have 4 full-time surgeons who are fully employed by Shriners, but they're also all on faculty at the University of Utah. All of Primary Children's orthopedic providers are also all on faculty at the University of Utah. And then in addition to those 4 full-time providers here at Shriners, we have 7 or 8 other pediatric orthopedic specialists who run cases, have clinic here as well, and they also are over at primary. So that's, you know, we do have that crossover there. Anyway, does that make sense?
Mm-hmm.
Okay.
And as far as insurance goes with the equipment that we do, for example, with the car seats, when they come in, we do send them out with a loaner car seat, and then we try and submit for a letter to your insurance. And then if it gets denied, they just keep the car seat that we loaned them. If it gets approved, then we swap them. So at least the child is safe in the meantime while we work with insurance. I will say that we have found currently that Medicaid is the only insurance covering car seats. There is no other insurance covering them. So we're doing our best to advocate for that and writing a whole lot of letters, but in the meantime, we're doing a lot of car seats.
And Claire, what's the typical cost of a car special needs?
Typical cost of a special needs car seat is at least $1,000. It can go up to $8,000 depending on what you need on them. They do have 2 car seats that come with kind of the same seating and position you would have in a wheelchair, where you have the lateral to support the kids that can't sit up straight, and they have the headrest and everything like that, which is great, but those costs skyrocket. So it's a little unreasonable, but
yeah.
And then with the wheelchairs, we do kind of a similar thing where we try and go through insurance first, and if insurance isn't going to cover it, then we have a bunch of wheelchairs that we've had donated to us, and we'll work with the families to get them a wheelchair as well. We don't limit kids to just a manual wheelchair, just a power wheelchair, which is the case in a lot of places. If they need both, then they get it. So. Anything else?
Any other questions?
Claire? Okay.
Thank you, Claire.
Thank you.
very much.
And you're welcome to call that number if you do have any more questions about anything. We're happy to. Thank you.
Great, thank you. It looked at getting here that I missed an announcement. So next month's meeting will be on August 15th at the USU site in Taylorsville and at the district site. And there'll be a discussion there about IEPs and 504s as we get ready for the school year to start. It's becoming increasingly relevant. Anybody have any other questions, ideas, resources to share, problems you want to talk about? Hearing none.
I don't think
you're on for the tour.
And for those of you who are unable to stay for the tour, a couple of other options. We offer public tours every Tuesday at 10, and those are just drop-in tours. Another option is to contact Neva or myself, and if you guys want to bring some colleagues up here, we could arrange for a similar type of meeting. We have some great meeting spaces, a smaller private dining room. The auditorium seats a lot larger audience. Or Neva and I are always available and willing and happy to go out to your, wherever you guys are at, and conduct a presentation to your staff and colleagues as well. Any opportunity that we can get to educate people about who we are and what we do. I feel like there's always so many misconceptions about that. Fortunately, with this group, I think you guys have had a lot of experience with us, but anything that we can do to help educate and inform, we would love to. So definitely take us up on that. And then in your packet, or these little, make sure everybody got one. Just a couple of things that I want to introduce. Again, the car seat clinic information is on here. Some new service lines that we have a new plastic surgeon on staff. Again, she's from the University of Utah, contracted to provide services here. One thing that she's doing that is new is simple or isolated cleft lip repair. So not palate, but just lip. Other plastic surgical services are things like scar revision, burn scar revision, ear microtia, etc. So keep that in mind. We also have one of our newer surgeons is Dr. Phil McClure, and his specialty is in limb deformities. He is here often. And we're really excited to have his expertise in the Intermountain West. He's one of the few surgeons who is specifically trained in limb deformities through whatever accreditation process is within the orthopedic world, but pediatric specific. So we're excited to have him on board as well. And then finally, hospital fact sheet in here, and then our patient pass-along referral card. Just keep in mind that, you know, we want to make referring to Shriners easy to do. Families can always self-refer. However, you know, typically we like to say if the call is generated from a healthcare provider, we can help expedite that referral. But really the prerequisite is that the child is under the age of 18 with a treatable orthopedic condition. And if you're not certain of what we treat, just call and ask and we can let you know. And Neva and I are always available to help facilitate referrals if you guys need follow-up on patients that have been seen by us, if you feel like communication is, you know, something that needs to be enhanced a little bit, definitely reach out to us because that's what we're here for.
You have those specialty clinics like a CP clinic and
Yeah.
how do you decide to appropriate those clinics besides just what
through our
intake with CP, but do all those just qualify?
Yeah, and again, you know, through our intake process, you know, they'll go through a series of questions, and once they've been seen in our clinic, at that time they will identify if that patient is appropriate to be seen in one of
they're
those.
seen in clinic and then
Yes, yes, yep, yeah, and that list continues to grow. So our multi-specialty clinic, CP, special needs car seat, skeletal dysplasia, osteogenesis imperfecta is one. We have a specialty CAN clinic, neuromuscular clinic. Our clubfoot clinic is, and that's another new piece of information. So we've run a weekly clubfoot clinic here at our facility for years and years. Primary Children's has also run basically the exact same clinic down the street. A couple of years ago, they decided to discontinue that clinic and relocate it to their Riverton location. So that Riverton location is covered by one of our surgeons and a surgeon from the U. So that offers parents both ends of the valley 2 different days of the week. We're actually adding a 3rd clinic day at our facility on Mondays as well. So Clubfoot Clinic will run here Monday and Thursday, and then also Monday at Riverton. So that's one clinic that just continues to grow and grow. And regionally, we're finding, especially in rural areas, a lot of orthopedic providers are still conducting a lot of surgical procedures on these infants with club feet, and that's just really not the gold standard for treating those kids. It is that non-surgical serial casting Ponseti method approach that we use. So again, anything we can do to educate those providers about that service that we offer, we'd love to promote that clinic.
Is the information that you listed here, does it list each of your individual clinics?
We can get you a more comprehensive packet. I think it just says, yeah, no, it's just, no. Short answer is no, but I can definitely get you a list.
That would be helpful.
If you can send it to Mindy,
Yeah.
send it to Mindy, and Mindy can then
As a recap, we'll do that.
disseminate it.
Okay, yeah, I'll do that for sure.
Great, thank you.
Good thought.
And so is it my understanding, it was just based on the question earlier, that if we have a patient with any of those diagnoses with your individual clinics, it is appropriate to make a referral, and then you decide after that diagnostic visit whether or not, you know, specialties within your system are appropriate.
Correct. And the benefit of those specialty clinics is one-stop shop for the parents and families. So they come in for that one appointment day, you know, that one time, and they're seeing multiple specialists on that same day, same location. So they're not having to bounce around. So, you know, for CP, they can come in, they'll see ortho, neuro, you know, depending on what their needs are, maybe GI, genetics. So it's very comprehensive in that regard, but it's also very convenient for the families to just make that one appointment.
And I'd love to know, like, which specialties they're seeing at each of those clinics, so that we can educate parents.
I will include that in our list.
Okay.
Good, thanks.
That'd be great. Thank you.
Yeah.
The other thing to keep in mind with regards to clubfoot clinics is that we offer tours for expected moms. Maybe you said that we have a movie
back, how do you run the process? So we have that opportunity for those moms to come and take a tour, see the clinic, get a station where you can actually watch the baby in between the capital sessions. Nice benefit. So it kind of puts their mind at ease a little bit, thinking someone I can talk to the hospital and then also overwhelming to be gold interns.
Great, well, that's wonderful. Any other questions? Thank you again to Shriners, Jill and Neva for hosting us. And feel free to go on your tour.
Yeah, and you're welcome to leave your, I guess, here if you want. 11. Okay. I'll be back.
You would not get, I don't care what it was hanging out.
And I love it, but.
Yes, yes, please, thank you.
I know that.